CV, I like to see three things. Can you do the work? Can you pass boards? And are you interested in scientific inquiry or looking to basically better the pulmonary critical care world, as a whole? That first question we often ask because the ICU can be a busy place. So we want to see that you've seen some volume before, in critical illness. If you come from a large tertiary center, that certainly sometimes answers that question right away. If you're coming from a community program, we'd like to see that you've had some experience with a large ICU. Sometimes people tell us that their ICUs, are still large in a community program, and I think that's important, to mention. Also, when it comes to passing boards, I think it's an important factor when we're looking at people, because passing boards is one of our biggest priorities. And then when it comes to scientific inquiry, it can be quality improvement. It can be anything from scientific research, basic science research, to clinical research. Just, are you interested in leaving information and disseminating it to others in the pulmonary and critical care world?
So what are things I look for on a CV? For me, most residents come from places that give them good clinical training, and so I'm looking for things that supplement that, things that show me that they've done stuff off the wards and out of the ICUs to be productive. So things like poster presentations, abstracts, publications are wonderful. Any type of scholarly activity that shows that they've been active academically outside of their usual duties. The other thing I look for is leadership. My goal is to get the best people I can, and I tend to think that those people tend to be people who take leadership positions within their residency program or within the hospital. So people who've done committee work, people who've worked on large projects within the hospital, I think is important.
So when I look at a resident's CV, I want to see a track record of board passage. I want to see evidence of scholarly activity, something that shows that they're going above and beyond the usual requirements of their residency program. And I want to see in the personal statement something that is personal, that demonstrates their drive and why it's important for them to be a pulmonary and critical care fellow.
There are many factors that I think are important. One, an applicant has to have some demonstrated leadership skills. So whether or not it's participation on a committee with leadership as a resident, or developing those skills through some activities that they've been doing teaching medical students, I think that's very important. Also, it goes without saying, excellent patient care skills. So any resident that has had some commendations for how well they've taken care of a patient, whether in clinic or in another setting, is incredibly important as well.
Things that set a fellowship application apart, I think, is something that a person has done to really demonstrate not only just a general interest in our field, but something that they've done that's gone a little bit beyond just the usual residency experience. So I'm looking mostly for people who have done some research experience, is usually what that shows up as, whether that's presentations regionally or at national meetings. Other ways that people can distinguish themselves is from particularly unique clinical experiences that show up in their letters of recommendation from their letter writers.
So for me, I like to see applicants that have engaged in a wide range of educational scholarship. And by that, it may be something as simple as a case report or something as significant as a first author publication. To me, it's important to see that an applicant has engaged in something meaningful and has completed the activity.
So we look for a team player, number one. Having great leadership skills is also important for leading rounds in the ICU. And then obviously just people who are willing to work hard and have performed well in their residencies.
The primary thing we are looking for in an applicant to our program is a drive to be awesome, a passion to succeed. And there is no specific metric for that. A lot of it comes across as, did this individual have a track record of trying to supersede wherever they were? Are they larger than the program from which they came? So it's not critical to come from the best residency program. It's not critical to have the best board scores. It is critical to show a passion, a drive to succeed. That's not something we can give you. We want you to come in with that.